Hello and welcome back to my YouTube channel. It's so wonderful to have you all right here, and it's still your favorite Nurse Francisca Ekene Aquila on Check My Clinic. And today we are going to be discussing about suicide. A lot of people have been committing suicide. A lot of suicide cases has been going on rampantly in our country, Nigeria. And today we are going to talk about suicide and how to know when someone wants to commit suicide. Welcome back. Suicide can be defined as an individual's taking his own life. A lot of people amongst the youth have been trying to commit suicide due to one issue or the other. There have been so many suicidal attempts, and suicide attempts can be defined as the taking of one's own life without dying in the process. It's still a process. Now we have who are the higher risks, or who are the people who are high risk of committing suicide. One, we have people who their family is quite dysfunctional. Dysfunctional in the sense that they've experienced firsthand physical and emotional abuse, such as also sexual abuse in the family. We also have people who have had suicidal attempts in the past. We also have people who are depressed, people who are lonely, people who have family history of mental illness or suicide attempts. We also have people who are dependent on drug abuse, or people who are dependent on some drug and alcohol, or people who are dependent on this drug alcohol. We also have people um, who are experiencing chronic pain, excruciating chronic pain. The truth is, at a point in time in my life where I had a leg fracture, and it really affected me mentally, in the sense that the pain was unbearable for me. I felt like taking my own life because I had a fracture and the pain was out of this world. So due to the pain and how it affected me mentally, and the fact that I couldn't do anything in life or at that point in time except being dependent on people, I have really had suicidal thoughts, but I'm glad I overcame it with the help of some friends and family and loved ones also. We also have the warning signs. What are the ways in which people can actually take their own life? We have taking of poisons, we have running over a moving vehicle, we have jumping from heights, we also have strangulation. We also have people using sharp objects on their body, on core areas on their body. We also have people probably get to drown themselves. We have people who stab themselves. All these are ways in which one can actually commit suicide. But we're not advising you guys to commit suicide. We're just educating you on how you would know when someone is with a poison. You know that this person wants to actually commit suicide. And we're also educating other people on what signs they should know, or what signs they should see when one wants to commit suicide. We have the warning signs here. We also have one talking about committing suicide. There are people who, when they want to commit suicide, they actually do talk about it. Yes, they tell you, I feel like I want to take my own life. Now, that is a suicidal warning, and you shouldn't take that lightly. You should actually follow it up. There are um, people who say goodbye, all those people who say goodbye to their loved ones and family. When people outrightly or over the blue start saying goodbyes to their loved ones, you should know that something is wrong and they are at the verge of committing suicide. We also have giving of important possessions or valuables. You see people giving out their properties and the whole stuff. You be like, what is wrong with this person? This person likely has the suicidal ideation. People talk about death often, how peaceful it is to die. It also entails that they might be planning a suicide anytime soon. Now, suicide is for all age group, all gender. A man or a woman can commit suicide. It's not exclusive to anybody. In as much as the female are likely to commit suicide more, the male also can also commit suicide. Now, people who use suicide, especially on social media, as threats to get attention. Yeah, most of the time, people, when they talk about suicide, it means that they are going through a lot, and they have so much stress on them, or they have so much stress they are currently passing through, and they really need attention. Please, if you do come across this post on social media, do not stigmatize them, do not make mockery of them or make a joke out of it. Always get to reach out to them to know what the problem is. Now, there's so many treatments and management for people with suicidal ideation, or suicidal, or people who have attempted suicide. They could first of all be taken to the hospital for them to see a professional. Yes, they can also have their psychotherapy sessions and also cognitive behavioral therapy. Now, if it's as a result of drug dependency or drug abuse, they could also be taught or they could also go through the treatment of people who have drug or who are drug abusers. Yes, so please, suicide is a very important topic, and it's something that is very rampant in our country, Nigeria, these days. And we urge and plead on behalf of people that when you have your loved ones who are going through a lot, please always show emotional support, family support, so that they would not have such addictions in their mind. When people do not care, it drives people to doing all sort of things. And the little things matter. The little things people do around you should matter. When you see someone is dashing you his or her phone, you feel like this person is actually dashing you out of dash sake. You don't know that this person is giving out his or her valuable items so as to commit suicide and leave the world. And you wouldn't know, you wouldn't have an idea. When people tell you goodbye in such an amazing manner, you think they're just saying goodbye. They might have suicidal ideations within them. And please, we should also always get to care for people the little way we can. Thank you so much for listening to our topic today. I hope that you do save a life after this video. You know when people want to commit suicide and what you should do to help prevent them.